Have you ever looked closely in the mirror or at a friend and noticed something a little different about their eyes? Maybe one pupil seemed slightly larger or smaller than the other. It can be quite striking and naturally makes us wonder if everything is all right. You should worry about different pupil sizes, a condition known as anisocoria, when the difference in size appears suddenly, especially if it is accompanied by other symptoms, or if it happens after any kind of injury or trauma to the head or eye. This rapid change is a key indicator that something might need immediate medical attention. Our pupils naturally adjust to light, getting smaller in bright conditions and larger in dim ones to control how much light enters the eye. While a small percentage of people, around 20%, naturally have a slight difference in pupil size that is harmless and called physiological anisocoria, a new or significant difference can point to more serious underlying health issues. These issues can range from problems with the nerves controlling the iris, which is the colored part of your, to more widespread concerns like a stroke, a brain tumor, a head injury, or certain types of infections. Even some medications, particularly eye drops, can temporarily affect pupil size. The suddenness of the change and the presence of other symptoms like headaches, double vision, drooping eyelids, or changes in consciousness are crucial signs that differentiate a harmless variation from a potentially serious medical emergency. If you or someone you know experiences a sudden onset of unequal pupil sizes, especially with any accompanying symptoms, the most important step is to seek immediate medical attention. This means contacting your eye care professional or going to the emergency room right away. Do not wait to see if it resolves on its own. A doctor will typically perform a thorough examination, review your medical history, and may ask about recent injuries or medications. They might also conduct neurological tests or order imaging scans, such as a computed tomography scan or magnetic resonance imaging, to investigate any underlying causes affecting the brain or nerves. Prompt diagnosis is vital, as the treatment for unequal pupils depends entirely on the underlying cause. Interestingly, for those with physiological anisocoria, where the size difference is normal and benign, the variation typically remains consistent throughout their lives. You can often check old photographs to see if the pupil size difference was present previously, which can be a reassuring indicator that it is likely physiological. However, if the difference varies or is accompanied by pain, vision changes, or other concerning symptoms, it warrants a professional checkup. Remember, the eye is often a window to your overall health, and changes like this can sometimes be early indicators of broader systemic conditions. Understanding when to be concerned about different pupil sizes empowers you to take appropriate action to protect your vision and overall well-being. While a small, lifelong difference might be completely normal, any new, sudden, or symptomatic change in pupil size should always be promptly evaluated by a medical professional. Early detection and treatment of underlying causes can make a significant difference in outcomes, ensuring you maintain optimal health.